The different levels of care are characterized by whether or not the patient can be managed in the home or whether or not patients are symptom managed in our hospice house. So if a patient cannot be cared for in the home and the symptoms are so out of control, such as pain or shortness of breath, and a nurse cannot realistically manage, or a family could not realistically manage that patient in their home, the patients are now referred to our hospice house, at which point the medical director is called. He makes a determination to whether or not the patient needs to stay in the home or move to a general inpatient level of care in our hospice house. And that requires them to be transported, as well as the nurse is required to have 24-hour care for that patient. In the home, that is considered a routine level of care, at which point the nurses don't stay in the home for 24 hours. At that point, the patient requires more attention, more clinical intervention, as well as more spiritual and social service intervention. And that's when we determine that that patient needs to be transitioned from the home into our hospice house. Respite care is a level of care where the patient and family are able to exercise being transitioned from the home to a facility for 5 days. Quite often families become very tired and they become very fatigued with taking care of a loved one that has a terminal illness. And that level of care is to quite often offer the family some type of relief from caring from the patient at home.